Hello everyone, my name is Beatrice Lewis and I will be presenting a community analysis of Citrus Park in Hillsborough County. The objectives for this presentation includes a historical overview, the community analysis, which includes the structure, the population, health resources, the environment, the government, the budget for the fiscal year 2015, the community needs, and global issues related to the community. Citrus Park history. Changes to the Citrus Park community has been taking place since the middle of the 19th century, when the community was mostly populated by citrus farmers and cattle ranchers. By 1930, Citrus Park had 617 residents, including 129 African Americans that were in the timber industry. However, by 1950, the evolution of the community was more noticeable due to several businesses and churches being built. Today, Citrus Park is an evolved city with recreational parks, shopping centers, and gated communities. Community structure of Citrus Park. The Parks, Recreation, and Conservation Department of Hillsborough County controls over 176 neighborhood parks and playgrounds, which includes 265 athletic fields, 10 regional parks, 13 recreational centers, and 61,000 acres of preserved lands. This community structure offers a variety of activities to the community which can have a positive impact on mental and physical health. Citrus Park has 50,810 people. Hillsborough County has 1,229,226 people. These facts make Hillsborough County the 30th largest county in the nation and the 4th most populous in Florida. The health-related resources in Citrus Park includes long-term care, acute care, emergency care, and hospitals. For example, the Town and Country Community Hospital is a general and surgical type of hospital with 201 beds available. It serves residents of the Hillsborough County and Pinellas County communities. The hospital is located only 4.7 miles away from the Citrus Park area. It provides services of diagnostic imaging, cardiology, behavioral care, emergency care, intensive care, orthopedics, and many more services that are of benefit to the community. The emergency department has 21 beds and is open 24 hours a day, 7 days a week. Three identified health-related needs in the Citrus Park community are associated to the Healthy People 2020 community objectives. Number one is the need to decrease cigarette smoking. Lung cancer is the number one cause of cancer-related deaths. The Healthy People 2020 objective is to decrease the rate of selected cancers to 10 to 15% less between 2007 and 2020. The second need is to encourage people on reducing fast food intake. Studies demonstrate that people who have high intakes of fast food are more prone to develop cardiac disease. This is the reason why Healthy People 2020 describes the reduction of the number of coronary artery disease as one of its community objectives. The third need identified in Citrus Park is education on the proper use of safety equipment to reduce accidents. One of the Healthy People 2020 community objectives is to reduce fatal and non-fatal injuries. The environment in Citrus Park is well controlled. Hillsborough County is served by the Environmental Protection Commission, which regulates and controls events that can cause contamination of the air, water, soil, and properties. According to the Air Quality Index, the Citrus Park air quality is 35, which is considered good. since a higher number can cause the increase of severe adverse health effects in a population. Hillsborough County has over 120,000 septic systems, and there are 3 companies that collect domestic garbage, recycling, and yard waste. One day a week, each family is provided with 2 different garbage pickups. In addition, there are local designated places where the community can drop off their recycling waste. The Hillsborough County government is divided in 2 branches: the legislative branch, which is represented by the Board of Commissioners, and the executive branch, which is represented by the county administrator. The commissioners make and manage policies for the administration of Hillsborough County and is responsible to supervise programs for the progress of the county and the benefits of its community. The community officials of Hillsborough County is formed by 7 members. 4 of them are elected from single-member districts. The other 3 members are elected countywide. Michael Merrill is the county administrator. He was appointed on December 9, 2010. The position of sheriff is determined by election every 4 years. David Gee is the head sheriff of Hillsborough County and is currently serving his 3rd term. On the other hand, the position of fire chief is designated by appointed. The 2015 fire chief in Hillsborough County is Dennis Jones. Each district in Hillsborough County has a commissioner representative, and members of the community can contact them by phone or email. The phone numbers are listed in Hillsborough County website. Additionally, the commissioners are available to listen to the suggestions, complaints, and needs from the community by allowing a 3-minute speak time during assigned meetings. Hillsborough County had $4,103,000 in revenues for fiscal year 2015. The largest amount of money came from property taxes. The allocation of these funds goes mostly to public safety, which represents a 39% of the total revenue money. The public safety category includes law enforcement, fire control, ambulance and rescue services, as well as disaster relief. Six areas that require assessment, analysis, and implementation in Citrus Park include homelessness reduction, crime rate decrease, communicable disease awareness, cigarette smoking cessation, sidewalk constructions, and the development of youth programs. The community nurse plays an important role when working with the community in need. The nurse can advocate for people that have been victims of crime. The nurse can also reach out to the homeless groups and provide resources to shelters and transitional houses that are available to them. In the same way, the community nurse can educate on the consequences of smoking and can develop different programs with different activities that involve the young community. In 2014, Hillsborough County reported 1,944 homeless people, which represented 87 more homeless families than the count in 2013. However, by 2015, there were 345 fewer families living in the streets and placed in homeless shelters. This improvement was possible thanks to the Tampa-Hillsborough Homeless Initiative to reduce homelessness. Likewise, Australia has a strategy called Homeless Health Outreach Team, which in cooperation with other agencies focus on people who are at risk of becoming homeless to provide assistance in a holistic way. However, other countries are struggling with the problem. India, for example, tried to support the homeless people with advice and programs, but unfortunately, the funds are not enough. It is known that a higher rate of communicable diseases is found among this group of people. This is a fact that puts the entire population at risk for an outbreak. But in situations like this, the community nurse serves as a coordinator of care and as an educator to prevent the spread of disease.